In this video, I'm going to explore the top 10 causes of finger pain in adults, from common injuries to underlying conditions. We're going to look at the symptoms, the causes and the treatments. I'm Stephen Bunting. I'm an MSK physiotherapist and sonographer based in the UK. Welcome to the channel where we explore the common MSK problems that normal everyday people experience and the evidence-based treatments that can help. So this is going to be a quick whiz through of the top 10 causes of finger pain, but I will explore each of these conditions in more detail in separate videos, which, when I've done them, you'll see popping up here as we discuss each condition. But I think you can only have about 5 of these pop-up cards in one video, so you might have to go looking in the description below to find the one you want. But the idea of this video is to quickly find out what the likely cause of your finger pain is, and then go and find the specific video for that condition to get into the nuts and bolts of it. Okay, so let's get started with the first of our finger pain felons, and that's a finger injury. And I'm not talking about fractures or other serious injuries because they're usually going to be dealt with in an emergency room. I'm talking about finger sprains. And don't underestimate finger sprains because they can be very painful. And they can take a long time to get better. In a nutshell, a finger sprain is a stretching injury to the finger ligaments, most commonly the collateral ligaments that live on the side of the finger joints. They're usually injured if you twist your finger or force it in a sideways direction. They're going to be diagnosed normally once a fracture has been ruled out by X-ray. And how bad the sprain is often proportional to the amount of swelling or bruising you might have a few days after the injury. In the first few weeks, the treatment is anti-inflammatories, either tablets or gel, or just the regular use of cold packs, plus gentle finger movement to stop it from stiffening. Later on, when the swelling and any bruising has gone, it's just regular finger movement and stretches until you've got your full finger movement back. And this can take much longer than you might think. A knee collateral ligament injury will usually get better over a few weeks, and 3 months at most, but a collateral ligament in the finger can take up to a year to get fully better. Yes, a year. So please be patient with these. Now just one word of warning. If your finger was bent backwards in this direction, then you might have sprained the ligament on the palm side of your finger just here, called the volar plate, which may require more specialist treatment. So if that's where your finger pain is, and your injury involves spraining your finger backwards, and especially if your finger grip is now much weaker and clumsier than you might expect, then do get checked out by a clinician, as sometimes the flexor tendons can become damaged with a volar plate injury. Our second finger pain felon is nodal arthritis. So this is osteoarthritis of the finger joints, which can produce these bony thickenings along the joint margins that we call nodes. The end joints are called Heberden's nodes and the middle joints are called Bouchard's nodes. The main symptoms of nodal arthritis are pain and stiffness of the finger joints. The pain usually starts as a minor ache and can then progress slowly over time, often years. The nodes actually develop later on. It's diagnosed by examining the finger and then confirmed by X-ray. Treatments involve the various rubs and creams, the use of splints and wraps. Therapeutic heat can also be helpful, and gentle exercises. After that, we've got injections and occasionally surgery. I've covered this condition extensively in this video, so do check that out if you think you might have nodal finger arthritis. Our third common cause of finger pain is infection. This usually happens after a cut or other injury that breaks the skin surface. Our skin is the main barrier to stop harmful bacteria from getting inside and causing infection, so when the skin is broken for whatever reason, this can create an avenue for the bacteria to get inside where it's nice and warm, where it can then start dividing and causing mischief. The common causes we see are cuts from kitchen knives, or spikes from thorn bushes in the garden, or from mucky garden or DIY tools. Animal bites, particularly cat bites, are also very common. Also, seemingly small cuts around the nail can often get infected because nails are generally full of bacteria, especially false nails, which are basically a bacterial holiday camp. The symptoms of a finger infection are pain, redness, heat, and swelling emanating from the area where the skin was injured. In most cases, the body's immune system will quickly kick into action and fight the infection. The typical response is that the symptoms will build up over a few days, reach a peak, and then steadily improve over a few more days. The whole thing is usually over and done with within a week or two. And the best thing you can do over this time is take painkillers, keep the finger clean with warm soapy water or antiseptic, and keep the finger moving so it doesn't get stiff. If you use a bandage or dressing, then make sure it stays dry, as bacteria like nothing more than warm, damp areas. If your finger infection isn't improving as expected, or if you have any concerns, then go and see your doctor, as occasionally antibiotics may be needed. Severe infections do need quick treatment. You'll usually know if you have a severe finger infection because the pain will be severe, constant and throbbing, and probably keeps you awake at night. Your finger will be very hot and swollen, and it won't be improving. So if this is your finger, then don't delay, because severe infections can be dangerous if left untreated. They can cause severe damage to the underlying finger joint and sometimes spread into other areas, causing sepsis. Intravenous antibiotics are sometimes needed, and the sooner you get treatment, the better the outcome. So it's an urgent care centre or the emergency room if you think that you have a severe, serious finger infection. Okay, so on to number 4, and that's tendonitis. This is also a common cause of finger pain, but it tends to be associated with overuse activities. We've got tendons that run down the back of our fingers, called the extensor tendons, and ones that run along the palm side of the fingers, called the flexor tendons. And it's these tendons that allow us to bend and straighten our fingers. Itis means inflammation, and so tendonitis is an inflamed tendon. The flexor tendons are most often affected by tendonitis because these are the ones involved in gripping and grasping activities, which tend to be the movements that we're going to do repetitively as part of our jobs or active hobbies. Tendonitis is nearly always caused by overloading these flexor tendons, essentially by doing too much strenuous gripping movements or by doing persistent, low-level, repetitive gripping activities over many weeks or months. The symptoms are often a sharpish pain and sometimes a swelling that runs along the palm side of the finger. The diagnosis is made by clinical examination, but the severity can be determined with soft tissue imaging such as ultrasound or MRI. Treatment is anti-inflammatories, either tablets or gels. Ice or cold packs can also help, but most importantly, you're going to need to rest from whatever you're doing that has caused it in the first place. If you don't rest your finger, it won't get better. Finger splints can sometimes help to protect the tendon from strenuous activities. Gentle finger movements are also important to stop your finger from stiffening up, and if you follow this basic advice, a finger tendonitis should settle down within a few weeks. If not, then do go and see a clinician, as a cortisone injection is sometimes needed. Number 5 is trigger finger, which is also a tendon problem, but it's not usually an inflammation problem. It occurs when you get a thickening or a small nodule on the flexor tendon, which stops it from gliding smoothly through the finger. Mild triggering might cause a clicking sensation in this part of the finger when you try and bend or straighten it. If it progresses, then the finger might get stuck in the bent position and you might have to force it open with your other hand, and it tends to release suddenly, like a trigger. It can be painful, and the pain is usually felt just here, which can also be quite tender if you have a poke around. It can affect any finger or the thumb. It's an easy diagnosis to make, and it usually doesn't need any tests or imaging. Treatment level 1 is to splint the finger straight at night for up to 6 weeks. Level 2 treatment is a cortisone injection, and level 3 treatment is surgery. Again, I've covered trigger finger in much more detail in another video, which is well worth a look, particularly because it shows a finger triggering in real time on ultrasound, which is really interesting to see. Okay, so we're halfway through. Number 6 is nerve pain. Now this can be a bit more complex, so I'll try and distill nerve pain down to the basics. The nerves that go to the fingers originate from the neck, and so a problem with the nerve anywhere along its length from neck to fingertip could potentially cause finger pain. The most common place for these nerves to be irritated is in the neck itself, where the nerve roots leave the neck to head off into the shoulder, where they combine to form the separate nerves of the arm. The symptoms of an irritated nerve root tend to be neck pain that can radiate down the arm and into the hand and fingers. Other symptoms can be numbness and pins and needles, which often just occurs in the fingers themselves. The C6 nerve root ends up in the thumb and index finger, the C7 nerve root in the middle finger, and the C8 nerve root supplies the ring and little fingers. With nerve root pain, it's usually fairly obvious that the pain is coming from the neck, and indeed patients will often tell me this themselves, but not always. It's rare to have just finger pain without any neck pain, but I have seen this a handful of times. The next most common cause of nerve-related finger pain are the compression neuropathies, and the two most common of these are carpal tunnel syndrome and cubital tunnel syndrome. Carpal tunnel syndrome is a condition where the median nerve becomes compressed in the wrist, causing symptoms of tingling, numbness, and sometimes pain in the thumb, index, middle, and just half of the ring finger. Cubital tunnel syndrome is a condition where the ulnar nerve becomes compressed in the elbow, causing similar symptoms, but this time in the little finger and the other half of the ring finger. I've covered both of these conditions in depth in separate videos, which you can find in the description. So those are the common nerve-related causes of finger pain, but like I said before, any irritation or injury anywhere along any of the upper limb nerves from neck to finger can potentially cause finger pain, but the presence of tingling and numbness is often the giveaway symptom that a nerve might be involved. Treatments are very much dependent on the specific type of nerve problem, so do go and look up the particular video related to your symptoms if you suspect that you have a nerve problem. Okay, next up is Raynaud's disease. Now this is a vascular problem which causes a restriction in blood flow to the hands and fingers. It's a condition more common in women and more common in cold countries, and indeed the colder weather seems to be the main aggravating factor. During a Raynaud's attack, the fingers will get very cold and can then feel numb, and they often will change colour, first appearing blue or white, and then later, when the blood flow returns, they can flush red and cause stinging pains, tingling sensations, and the fingers can swell. There's no known cure for Raynaud's, and we really don't know what causes it, although we do know that it's more common in people with poor circulation anyway, such as smokers and diabetics. Even though Raynaud's can affect your quality of life, symptoms are usually fairly mild and manageable and don't tend to cause severe or disabling pain. The best treatment is to avoid causing an attack in the first place, and so keeping your hands warm in cold weather is really the best option. Try using mitts rather than gloves, as mitts are usually much warmer. If you have persistent symptoms, or if the skin on your fingers is getting broken and infected, then do go and see a doctor, as there are treatments available which can help, including drugs that can dilate the blood vessels. Right, so on to number 8, which are the various ganglion cysts that can affect the fingers. These are fluid-filled cysts that can feel soft or very firm depending on the pressure of fluid within them. The three most common finger cysts are the digital mucus cysts, sometimes called myxoid cysts, that occur at the end of the finger near the nail, the synovial cysts that occur around the middle finger joints, and the pearl ganglions that feel like firm pea-sized lumps in the palm side of the fingers near the crease where the finger joins the palm. All of these are harmless, but they can cause pain and interfere with finger function. In order of involvement, treatments can vary from just leaving them alone, using creams and gels, having them aspirated with a needle, or having them surgically cut out. My detailed video on wrist, hand and finger cysts can be seen up here, but I would always advise seeing a healthcare professional first with any lump or bump, just to make sure that it's nothing more serious. Okay, so we're on to the final furlong, and the 9th most common cause of finger pain is gout. This is a type of crystal arthropathy. Arthropathy just means a joint problem, but the crystal bit refers to the root cause of the condition. It's caused when you get a build-up of a chemical called uric acid in the blood. When uric acid reaches a certain concentration, it can start to crystallise, and it tends to do this in the joints, most commonly the big toe joints, but it can affect any synovial joint, including the small joints of the fingers. During a gout flare-up, the affected joint or joints will become very painful and often red, angry and swollen. Initially, treatment is by anti-inflammatory medication, but if it becomes a persistent problem, then you will need to see a healthcare professional. A blood test or a sample of joint fluid can confirm the diagnosis, and the long-term treatment involves specific drugs to lower the uric acid levels in the blood. Gout really is a fascinating condition, and if you want to learn more, then check out my more detailed video, again in the description. And last of all is a fairly rare condition that can cause intense pain under the nail bed of a finger. It's called a Glomus Tumour, and it's a benign growth involving the small blood vessels underneath the nail. It's only very small, and therefore you might not see anything visibly wrong with your finger, which might be surprising as the pain can be really intense. Other symptoms are extreme tenderness when pressing the nail, and the finger can become very cold sensitive. If the tumour gets big enough, then you can sometimes see it as a bluish area under the nail. The diagnosis is made using MRI or ultrasound imaging, and the only effective treatment for a persistently painful glomus tumour is to have it surgically removed. So you're going to need to see an orthopaedic surgeon or a plastic surgeon. Okay, so well done for making it to the end. If you do have finger pain, then I hope you found the potential cause among these 10 conditions. But of course, there are many other less common causes of finger pain, and you can see a few of these conditions popping up here. I do hope you found the video helpful. Don't forget to look in the video description to find the more detailed video related to each of these conditions. I've done most of them already, and the others will appear as soon as I've done them. Okay, well that's about it. Thanks very much for watching, and bye for now.